BMC Public Health's assessment of medical waste management in 7 hospitals in Lagos, Nigeria. The majority of the respondents were domestic workers. The aforementioned is in contrary to the study of Joshua et al. The aforementioned is in contrary with the study of Joshua et al., which was carried out in some primary healthcare centers in Zaria, Nigeria, where majority, 37%, were nurses and no domestic workers were used for the survey on waste disposal and management. Given that domestic employees are heavily involved in waste collection and transportation, their involvement in waste management is both unavoidable and logical. It is obvious that the volume and variations of trash produced in each facility must be taken into account for a waste management program to be effective. The Lagos State intervention through the awareness and training programs established by Lawma Medical Unit for proper segregation of infectious waste, adequate classification, and disposal of the trash may be responsible for the decrease in the average generation rate that was seen in this study. While the wastes produced in healthcare facilities include wastes from food preparation, radioactive wastes, wastes from dialysis procedures, biological wastes, cardboard, paper documents, and used linens, they also include cultures, stocks of infectious agents, pathological, blood and other fluids, sharps, surgery and laboratory wastes, and wastes from sharps disposal and laboratory work. The main factors to consider while choosing an efficient medical waste management technique are the source, classification, quantity, and quality of the waste generated. The medical staff in the institutions under study have sufficient awareness of the many types of wastes produced. 2/3 of all respondents correctly classify both general and infectious garbage, which results in proper waste segregation. This is because they participate in more hospital waste management training, both internally and externally, and they also include the yearly capacity building events held by the Lagos Waste Management Authority, LAWMA. To achieve sound medical waste management, infectious waste must be separated at the point of creation. According to the study, the majority of participants supported the separation of medical waste at the point or source of generation. This separation of infectious trash from general/domestic waste is accomplished by using labeled containers or colored liners. The large percentage of responders that use color coding for identification shows how well they realize how important it is for managing medical waste. The color coding of trash, which is crucial for appropriate waste segregation, was sufficiently understood. Using actual colored containers or colored liners to adequately separate infectious trash from general/domestic waste allows for proper segregation. In a 3-bin system, the WHO suggested that hospitals use different colored liners, specifically black, yellow, and red, 3-bin system, for general, infectious, and extremely infectious waste, respectively. Hospitals should also use plastic bags or sturdy plastic containers for medical waste. The ability to recognize the color coding for pathological wastes was statistically significantly correlated with the respondents' profession, with nurses having the strongest correlation, which is also a result of their training. From the point of generation to the on-site storage, a variety of methods were used to move wastes. Nevertheless, wheelbarrows and trolleys made up the majority of methods used to evacuate wastes in most facilities, which is consistent with the findings of Joshua et al. Every day, medical waste created in hospitals is collected and brought to a short-term storage facility inside the hospital. Although the WHO mandates that different trolleys be used to convey the various sorts of garbage, the majority of the hospitals that were assessed do not follow this criterion. In all hospitals, domestic staff and sanitary officers are in charge of collecting the separated medical wastes from the wards and bringing them to the on-site storage facility. The hospitals studied utilize just heavy-duty gloves, which is inconsistent with the WHO's recommended standard, which calls for the use of heavy-duty gloves, boots, and an apron, despite the importance of protective equipment for anybody who handles medical wastes. The lack of manuals and guidelines indicates that there are no defined policies and plans in place for handling medical waste in the hospitals studied. Further research revealed that there are no manuals or recommendations for the management of hospital garbage, not even from the Ministry of Health. In fact, it was discovered that there is no national or state policy or guideline for the treatment of medical waste. For hospitals in industrialized nations with clear rules and regulations at the national, regional, and hospital levels, it is crucial to design standard operating procedures (SOP) for the handling of medical waste. If you learned anything from this video, then like this video, and then share this video with your close friends. Please make sure you subscribe to our channel as we will release more great videos in the future.